Leukemia is a type of cancer that affects the blood cells and bone marrow. You see, bone marrow is responsible for making blood cells like WBCs, RBCs, and platelets. But in leukemia, we have an overproduction of white blood cells that crowd out the production of normal cells, leading to low RBCs and low platelets. So let the name help you here. Leukemia, just think leuc for leukocyte, that WBC, and emia for blood. Too many WBCs that crowd out the production of other blood cells. Now, the main types of leukemia, we have acute and chronic. So acute is more common with pediatrics, and chronic is more common with older age. The four main types include AML, CML, ALL, and CLL. Now, the NCLEX doesn't really cover this directly. Now, in terms of labs, we have high WBCs, but they are very immature and too young to fight infection. So we call them baby WBCs that crowd out the production of RBCs and platelets. So naturally, we see a low H&H, that low hemoglobin and hematocrit, and low platelets, which leads to higher risks for bleeding. Now, the signs and symptoms include frequent infections because the WBCs are too immature, and remember, too young to fight infection. We also see fatigue and an unsteady gait, as well as pale, called pallor. This is from anemia, that low H&H. So just think we have less oxygen carriers and less perfusion to the brain, skin, and muscles, looking very anemic. And we have bruising, petechiae, and easy bleeding from the low platelets, as well as weight loss and anorexia, and even bone pain from the bone marrow being overcrowded with an overproduction of WBCs. So ATI mentions a 7-year-old with acute lymphoblastic leukemia who is being admitted for evaluation of fever. To which of the following rooms should the nurse assign the client? A private room in order to prevent transmission of infection from others. Yes, we want to protect this patient from getting other infections. Very low immune system from those immature WBCs. Now, a second question, a nurse is assessing a child who has leukemia. Which of the following findings should the nurse expect? Select all that apply. So we have anorexia, petechiae on the extremities, and even an unsteady gait. And the third question, a child who has leukemia has a platelet count of 40,000. Oh man. Remember, anything less than 50 gets very risky. Which of the following precautions should the nurse initiate? Bleeding. So remember, anything less than 50 is very risky. Big time bleed risk. Now, in terms of diagnostics, we can do a bone marrow biopsy, typically taken from the posterior iliac crest, basically on the hip bone here. So Hesse mentions, a nurse is preparing a patient for a bone marrow biopsy, knows which site will most likely be used. Posterior iliac crest. Now, in terms of the treatments, we use radiation and chemotherapy to kill everything off, the good guys and the bad guys too. And very rarely we use a stem cell transplant, like hitting the restart button to reboot the entire system for bone marrow.